Good morning, everyone, and afternoon to those of you who are in the afternoon time zone. This is Neil Halpin, and I'm happy to be able to welcome you to the sixth webinar in this series, Measuring Health Development of Children and Youth, from the Life Course Research Network, hosted here by our UCLA Center for Healthier Children, Families, and Communities, and funded by the Maternal Child Health Bureau of the Health Resources Service Administration here in the U.S. Specific focus today is on community-based systems approach, and we'll have several presenters, and I'll be introducing them in a second. I'm Neil Halpin, and I'm the director of the center here at UCLA, and been directing some of the Life Course Research Network work the last several years, and have handed some of that over to my colleague Alice Kuo at this point, but I'm still sort of hosting these webinars. My role today is to help host this webinar and lead through some of the Q&A at the end. Before I introduce our speakers, I'll take a moment to provide a few guidelines for the webinar technology and recap the past webinars to help provide some context for today. From a technical standpoint, during the presentation, all participants will be muted. As a precaution, please be sure that your microphone is also in the mute mode so we don't have any feedback. At the end of the presentations, we will have a Q&A time, and we're hoping that we'll have at least 20 to 30 minutes for questions and answers and for discussion as best we can. We hope that you will ask your questions and share your thoughts. Given that there's a large number of participants, the best way to do this, submit your question using the chat function, and we will read it aloud for you. Unfortunately, if you've joined our webinar by phone only, the web system will not allow us to unmute you for the discussion. If you would like to ask a question or contribute, please email the project assistant, Jason Timmerman, at jmtimmerman@mednet.ucla.edu. Experience any technical difficulties during the broadcast, please let us know by using the chat function or by emailing us. And now just to recap where we're at in this series. We began this as a way of sharing knowledge between the US, Canada, and Australia, because all three nations have been busily trying to use new measures of population health development, specifically the EDI, MDI, and related measures. This work has really been pioneered and led by folks in Canada, both at McMaster's University, University of British Columbia, at the Human Early Learning Partnership HELP. What we've been trying to do is understand how the colleagues in BC have been building a comprehensive life course monitoring system and using these systems to engage and mobilize local stakeholders to collectively improve early childhood and children's ecosystems. How the two important population outcome measures, EDI and MDI, and we've had webinars about both of them, so if you're joining for the first time, you can go back and look at those. Have also covered how those have been used in Canada, the US, and in Australia. This is the sixth, and we'll now be turning to community practice and what's being done with this data and engage communities and to advance improvement in communities using a variety of different sort of frameworks for thinking about it. Issues like equity and compassionate relationships and building leadership and the like. Today, our speakers are Brenda, Poon, Joanne, Schroeder, and Efren Aguilar, and they'll all three be taking this community-based systems approach to considering measurement. Brenda Poon is a PhD and is assistant professor at Human Early Learning Partnership at UBC. Her lab has been funded for a decade through multiple government grants, and she and her staff have successfully conducted multi-year large-scale studies of implementation processes and outcomes for 3 population-level interventions with the aim of identifying early-stage developmental concerns. Joanne Schroeder is a former deputy director and is currently senior policy fellow at the Human Early Learning Partnership. She's also the executive director of COMOX Valley Child Development Association, a multi-service agency on Vancouver Island, which has given her a unique lens on putting research into practice. Efren Aguilar is the GIS technology lead at the Center for Healthier Children, Families, and Communities here at UCLA. He applies cutting-edge GIS and web-based technologies to support planning and evaluation practices that emphasize the impact of neighborhood conditions on individuals and on community health. We'll take about 45 minutes to hear from the 3 speakers and then reserve 15 to 25 minutes. We have an hour and a half scheduled, so we'll have plenty of time for questions. And we'll ask you to hold your questions till the 3rd speaker has a chance. So I'm going to turn this over, and I understand that Efren's going to lead off and then be followed by Joanne and then Brenda.
All right, thank you, Neil, and welcome everybody. And just want to clarify very early on, we're talking about community systems, but and Neil mentioned ecosystems just a minute ago. And we just want to let people know that community systems are ecosystems. They're comprised of complex and dynamic relationships across multiple interacting, and interdependent factors. And for those of you who find that language a little bit vague, the best way I can really articulate that is there are many people that that live in the same neighborhood as you do, but you do not interact with them. And then there's that you interact with, and then there are those that you're interdependent upon. So that's different levels of relationship. Now, these factors include community conditions, service agencies and their programs, elected officers and service providers, as well as the residents and the shared history that connects everything. And just as an infographic, the way we can see how these things interrelate together is you have your service sectors, you have your residents, you have your socioeconomic conditions, things such as wealth, poverty, education, employment status, the built environment, which is the infrastructure, toxic building materials, lead paint, for example, parks, adequate housing, et cetera. All of these comprise this community-based system, which is also the ecosystem that Neil referenced earlier. All of our work starts with life course development, being that this is a life course intervention research network. This is not new to you, but this is a graphic that Neil helped on, and his team actually developed this life course health development, past, present, and future. Here you see different developmental trajectories for children. And we know that these things actually are impacted by those things that occur before birth, but just looking at from the individual life of a person, you have factors that push down, things such as poverty, lack of health services, and toxic stress have a negative impact on your developmental trajectory. But then there are also things that actually mitigate and address those, things like parent education, reading to your child, appropriate discipline, health services, and preschool. They all interact together to affect the life course development. But what does this tell us at a neighborhood level? In our relationship with some of our community partners, one of them being South Los Angeles, California, they actually thought about it this way, almost like a game of chutes and ladders, where you have the chutes being those factors that inhibit healthy development, and the ladders being the factors that promote healthy development. And that first thing that it led folks to realize is that not all game boards are the same. Some of them have distressed neighborhoods have many more chutes than ladders, and thriving neighborhoods have many more ladders than chutes. And this is actually its opportunity gap in the development of children. It actually shows an unequal playing field. One of the things that we want to really think about in terms of this presentation is to discuss the relationship that these community contextual factors have on early health and development. We'll be using the Early Development Index instrument as the guide, and then we have a measure of neighborhood risk. Before we get into that, just want to let you know that the Aspen Institute Roundtable on Community Change discussed strategy and evidence to improve place-based work. So the first is using longitudinal data about both individuals and communities to understand neighborhoods and increase the effectiveness of place-based work. The national or the international example that would be Vancouver. The University of British Columbia have developed this really incredible longitudinal data set both on the individuals, and what we will be providing today is a conversation around those community contexts to show the relationship between the two. There's also, they identified needing to help practitioners make better use of data for planning, program management, and assessing progress, as well as finally building a durable database infrastructure and evidence base to inform the place-based work. And as mentioned today, we'll be talking about Neighborhood Risk Index and the early development instrument in this regard. So here's a review overview of the Neighborhood Risk Index that we're using. It's borrowed from Charles Bruner in his paper ACE, Place, Race, and Poverty, Building Hope for Children, published in Academic Pediatrics 2017, I believe. Yeah, 2017. So here you have 10 community risk factors. Each of these sound like there's some positive indicators as well as some negative indicators. But really, to be a risk factor, you'd have to be one standard deviation, one standard deviation away from the mean. So you have high concentrations of percent single-parent families, percent poor families with children, percent of children, percent of the adult population with no high school diploma, the percent of the population with a college degree or higher. Then we have these disaffected youth, that percent 16 to 19 not at school or work, percent of head of households in public assistance, percent of head of households with wage income, percent of head of households with interest, dividend, or rent income, and the English limited speakers and owner-occupied housing. And what they've done is his group has actually classified each census tract into four risk categories. Those with no vulnerability factors, those with 1 to 2, medium is 3 to 5, high 6 to 10. What you see, and this is actually what a lot of folks have seen over the years, this is a map of Los Angeles, California, with the area there is one of our partners that we're working with, the Magnolia Community Initiative. And a lot of the population data that people see are these, just clusters of negative risk. It's a measure of concentrated risk. And one of the things that we know about these measures of concentrated risk is that these are not random. These are the result of historical policies that actually create these environments. So this is the very infamous geography of Los Angeles. This would be South LA. And a lot of folks who are familiar with the Los Angeles context understand that this is the area of high risk factors for healthy development. What we have found in our analysis is that these risk factors actually have a major impact on the development or the results that you see on EDI. So here we have a simple map, a graph that shows the relationship between the proportion of children vulnerable on the EDI, and on the bottom you see each of these is the different levels of domain, and in the color is an indication of the level of risk. The darkest color red are the highest level risk communities with 6 to 10 factors. The gray is the areas with no vulnerability or risk factors. And you can see this consistent monotonic pattern of increasing rates of vulnerability on the EDI with the higher concentrations of neighborhood risk indicators. The implications in the way we make sense of these is this infographic here. Since most of the data most folks see, it would be just an example like this. Each of these children would be representative of a neighborhood. And what you normally see is how well a neighborhood is doing on a given measurement. And then so here, what these data show you is that there's the two of the neighborhoods on each end of this kind of array have the highest most of the kids who are performing on track. Then you have the bottom performers, or the second and fourth child or neighborhood, and then the neighborhood in the middle is doing pretty much just kind of your average. But when you look at these data without the community context, meaning the measure of neighborhood risk, you actually get a different pattern when you take into consideration those kind of assets they have. And if you were to assess a child's performance or neighborhood's performance on human development based on the vertical leap, when you look at the community contextual factors or you adjust for the risk, you actually see a much different kind of a scenario here. And really what it highlights is that child that was in the middle that looked like they were just doing on average performance, are actually performing way above the expectations. And what we really would like to do is we are starting to take our data analysis to actually adjust for risk. So what it would look like is by mapping this bivariate matrix. This is developed by Josh Bader, our chief GIS analyst here. We have neighborhood risk classification on the bottom, 0, low, medium, and high, and then EDI vulnerability, lowest to highest. The gray bar, the gray area would be those census tracts performing as expected. So if you have 0 risk factors, you would have the lowest rates of vulnerability on the EDI. And if you have high risk factors, you'd have the highest rates of vulnerability on the EDI. But this map is identified to highlight those positive and negative deviants, those performing better or greater than expected. And if you look at the table on the side, you can see when mapped this way, you have a very nice bell-shaped curve where 2% of the geography, 2% of the census tracts are in these high-performing or low-performing areas. When mapped spatially, however, you really begin to see some really wonderful patterns. So this is just to remind you that we're looking at neighborhood risk as compared to the EDI. This is that graphic that we went over earlier. This would be El Monte. This would be mapped, their neighborhood risk category mapped. You can see in the southeast area of El Monte, you have higher rates of vulnerability. But when you compare it to the EDI, you get to see this different kind of pattern emerging. So whereas you had that southeast area would be the neighborhoods with highest risk, but what we're finding when we measure the EDI data, they have some of the lowest rates of children vulnerable on the EDI. And you see a general pattern of in this kind of the blue colored shading map, which indicates that either they're performing as expected or performing better than expected. What we find is that these patterns actually are not spatially random, but they're actually, they're actually geographically proximal to one another. Here's South LA. It's the area that we mentioned earlier in the other slide that really beginning the discussion on neighborhood risk. As you can see, each geography, there's a predominance of them that are in the highest risk categories, having 6 to 10 risk factors. This is the 110 corridor, right above the 105. Obviously, an area of geography made infamous in our popular media and culture, very high risk. And most people, when they think about this geography, they think about it in its negative consequences of living there. But when you look at how children are doing on the EDI, using the EDI measure, you get a different assessment of their capabilities there and the strength of the community. And you see these distinct pattern of overperforming expectations. These risk-adjusted maps are really changing the way we appreciate, interpret, and discuss these communities, and gives a lot of opportunity for us to explore what's actually happening here, how we can replicate these in other similar communities. Finally, here's another community neighborhood risk index. This is Pasadena, California, another one of the cities that's been working with us for quite some time. This is a different kind of a risk situation here, where they have generally 0 risk factors to low risk factors predominantly in their community. But when you actually map the EI data to it, you see a different pattern than you saw in the other 2 examples, where you see more folks, more of these neighborhoods are actually have higher rates of children vulnerable than would be expected based on their neighborhood risk index, which is another indication that simply looking at concentrated risk doesn't give you all the information you need to assess what's happening at a community level. Using the EDI data alone also does not give you all that you would need to make sense of what's happening. But when you compare the 2, it really creates a much more nuanced conversation. Before I go on to the close out the session, I want to let you know that the EDI in the United States context is being collected over a large number of geographies. This is looking at Los Angeles and Orange County performance. Just to highlight the area on the top left is that South LA area. The one in the middle is a community called Downey, and then the larger geography is all of Orange County. And you can see distinct patterns of overperforming and underperforming census tracts Again, just trying to get your sense of what it looks like when you blow out to a larger regional area. This is, of course, areas of Texas, Hidalgo, and Cameron counties. That squiggly line on the border there, that's the Rio Grande. And here you have county level differences in performance on this, looking at it this way, whereas the area in red, that's Hidalgo, that's the area in blue is Brownsville, and the area in red, there's McAllen, and then you have Willacy County mostly overperforming expectations. And then finally, in light of the events that happened over the last few weeks, this is El Paso, and you can see clear, distinct areas of overperforming and underperforming census tracts, with that area along the border there being predominantly overperforming expectations. Now, the beauty of having these data is also multifold, but more than anything, it really allows for lots of learning opportunities. So for each of these different geographies, you have the expected outcomes, which is creates a typical learning area. But then we also have the places that are overperforming expectations. So you have a natural learning lab in those high-risk communities. So what's happening in those communities that can be replicated would be a lot of fruitful conversations that we have with community, with the residents and the service providers. But also it allows for an opportunity for us to learn in these higher risk, these lower risk communities, to replicate to find out what in fact is happening that would increase the rates of vulnerability in there. And then of course we have obviously across the different across these different the low to medium risk, the same kind of learning opportunities. So that concludes my the slides for today. Thank you very much. Oh, having technical difficulties advancing my slides here.
Thanks, Efren.
Yes.
And we'll turn this over now to Joanne to continue on. Joanne, you ready? We're not hearing anything.
I am, I think. Hi. Can you guys see my slides? Did I do that correctly?
There you go. And if you put it on the slide presentation, it should take off. There you go.
Okay, you can hear me okay. Thanks so much. Really nice to be a part of this webinar this morning. I'm just going to start with a little bit of an acknowledgement of the Indigenous people of Canada. I'm talking to you today from Vancouver Island, which is the traditional territory of the Comox people. I really have drawn so much for this work on Indigenous ways of knowing and being. And we really are hoping that this approach, this renewed approach around compassionate systems leadership, will contribute to the path that many of us in Canada are on towards reconciliation with our First Nations people. I'm really going to talk today about, I think it was the second point on Efren's slide from the Aspen Institute about helping practitioners use the data in a different way. And so really the focus of my presentation is going to be around skill building and engagement with people who are actively working in community systems. In British Columbia, as Neil has referenced, we have been collecting population level data using both the EDI and the MDI for coming up on 2 decades, actually. The first work in Vancouver was in 1999. And we're about to release our 7th full data set for the province of British Columbia of the EDI. And we've spent lots of time working with communities, working with organizational systems, really trying to help folks engage with the data, using the data as a catalyst for action. but really what we have discovered in BC, which is pretty consistent with some of the trends and data across the entire country, is that things are going less well than we would hope them to, and that continuing over the past decade, really, we've had about a third of our children provincially vulnerable in some aspect of their development. And in fact, in the last couple of data collections, we're seeing children who are more likely to be vulnerable in, more than one aspect. So showing vulnerability in 2 or 3 domains of development. But the only positive trend that we've really seen in the data is around the language and cognitive development. And we have definitely seen some gains in that area, but in the majority of the other domains, provincially, we have been having a trend to more vulnerability. So for those of us who have been working with this for a lot of years now, it really has behooved us to think about what could we be doing differently to really support community service providers and community systems to get some different outcomes. The child serving system in Canada, probably not unlike most places in the US, is fragmented. The complexity of really trying to work across the entire system seems to get more and more complicated. We have very many ministries and privately funded organizations that are involved in trying to support children. We have discovered, as I said, over the past couple of decades, that just having the data there for communities to look at, it has created some very exciting initiatives and small pockets of promise. We haven't really gained any traction in terms of spread and scale. So really wanting to look at a different approach. And you see that quote there, the success of an intervention depends on the interior condition of the intervener. Sorry, my phone just started to ring. The success of an intervention depends on the interior condition of the intervener is actually a quote from a guy by the name of Bill O'Brien, who was the CEO of Hanover Insurance, that really it resonated with us at the Human Early Learning Partnership about what can we do to actually build the capacity of the folks who are acting in the community systems in a way that leads to more effective action for children and families. What you're seeing here is a very high level theory of change in terms of the work that we're doing around growing compassionate systems leadership. So it is our premise that the first step in this is to teach service providers, champions for children and communities around BC, some compassionate leadership skills and more systems thinking capability, allowing them to then actually demonstrate those new skills and understandings in their context, leading to the improved collaborative and systemic planning and action, and ultimately the changes in policy and collaborative practices that we would like to see. And there's that little pot of gold at the end of the rainbow there in terms of improved outcomes for children. In respect to the work that we're doing now, it's really focusing on the top 2 circles of that theory of change. We're out in communities teaching people compassionate leadership skills and systems thinking capability. And I'll talk a little bit more about the detail of how we're doing that. Really, our approach is about bringing together these 3 interconnected domains of learning. The foundation is really intrapersonal development and commitment to change. We're teaching interpersonal skills, and then we're teaching systemic thinking approaches, ways to understand how complex systems and specifically complex child-serving community systems are behaving and how people can find ways to intervene in those systems. Briefly, these are the personal learning outcomes. I won't read them all. You can see there it's a real focus on increasing self-awareness, understanding personal values and assumptions, and affirming where you would like to go, as with all of our learning domains, based on a foundation of compassion. The collective learning outcomes, and we really have taken this approach that we're working with community members who have been working together in collaborative practice and will continue to work together in collaborative practice towards improving outcomes for young children, and moving them towards a collective plan for action that they will then go away and do together. So there's a fundamental belief that rather than having folks going off and just doing training on their own and then coming back and trying to enact some of those within their community system, that bringing more, multiple folks from the same community together can be more impactful. And then finally, the systemic learning outcomes. This is where we bring back in so much of the data that HELP has collected over the years to help folks understand really what the state of children and families in their community is. So we certainly haven't gone away from believing that data is an important catalyst. We've just sequencing it a little bit differently in terms of trying to prepare folks and communities to deal with the data from a different perspective. We have had 3 community early childhood coalitions that we've worked with over the past year. They've all received 6 days in those 3 two-day sessions. We have done monthly coaching calls, and they are engaged in their collaborative practice on a regular basis. Those groups have been about 10 folks, mixture of public health, school system, child protection, First Nations communities. So just a little bit of a different mix of people depending on where we were. And then we've had a community of practice in Vancouver, which we've had a little less intense of an involvement with, and just had those 5 half-day sessions. And the individuals in those cases were not collaborating on a regular basis, and so that was part of our learning for sure. This is very much a approach to learning of continuous adaptation and learning forward. So very big focus on practice and reflection alone and together, and then adapting the approach as we go. To be very honest about it, myself and Pippa Rowcliffe, who is currently the Deputy Director of the Human Early Learning Partnership, and my partner in this, have been learning as much as the participants, I think, as we have gone along. So it's been a deep learning journey for us all. Just going to give you a little bit of an inkling of some of the tools that we're using in the Compassionate Systems leadership framework. As I said, compassion underlying all, and really that overarching disposition and how we present ourselves across every interaction that we have. We use regular compassion meditations as part of the curriculum. Pippa is trained through Stanford and the Cultivating Compassion training, and so that's the theoretical approach that we've been relying on in terms of our approach to the compassion piece. I probably have too many slides, so I'm going to go quickly here. Certainly just increasing mindfulness as a life practice is another foundational piece of how we're doing the Compassionate Systems leadership work. I love John Kabat-Zinn's definition of mindfulness, and that is paying attention in the present moment, non-judgmentally, as if your life depended on it, because your life does depend on it. And so it's really helping folks develop across their life practices that will then bring them to a broader awareness of themselves, others, and the systems within which they're working. We love the systems elephant. I'm sure lots of you have seen this, but it really is that old Indian fable of everyone comes to a community system from a very different perspective. And I think this is doubly true within the child serving systems in Canada, because each person brings a different training, a different discipline, certainly a different experience to the work that they're doing for children and families. And so trying to bring those folks together, acknowledge their perspective, and help them contribute to seeing the whole elephant is really, in our way of approaching it, the key to understanding systems is to really understand the elephant from all its perspectives. We use very much so the an iceberg metaphor, which is a very common metaphor in systems thinking, allowing people hopefully to identify the symptoms and problems that they have been focused on. And certainly in our context, childhood vulnerability as measured by the EDI is one of the symptoms that folks have focused on. And what that has done, more so than we would have liked, has caused people to react to that as a problem. Oh my goodness, our vulnerability has started to skyrocket again. Let's put in a new lunch program, or let's make sure that all of our kids have jackets to wear, so that it can get you into a bit of a vicious cycle around trying to do something very specific to react to the problem, but not actually going below the surface of the water to understand what are some of the structures and processes, what are some of the systemic factors that are contributing to those symptoms. And certainly, if you look at the question of kids not having jackets, giving them jackets is not actually getting underneath the water and starting to unpack, unpeel, address all of the structures and processes that are leading to children living in poverty anyway. So they're much longer term solutions, but they're solutions that we think can be more enduring. So that's just a very, very brief introduction to the tools. We're actually just in the last month or so of creating a full guide around growing compassionate systems leadership, and certainly we'll be glad to share it with our colleagues at UCLA and anyone that's interested. Just to finish up, the learnings that we've had in this first year of going deep in communities with the compassionate systems leadership framework. There's a deep resonance with everyone who participated in the program. All of us who are working for Change for Children can feel a little fatigued and a little cynical at times. I think that's a natural experience given the context. And so to feel like you're building a sense of compassion and awareness has really resonated with folks. Everybody has adopted lots of new practices, and we've been tracking the practices and tools that folks have used the most commonly, so that we're getting an idea of which of the things that we're introducing to people are helpful. We do believe, as I said, that it's most beneficial to train people who will then go on and work together regularly. Much deepened capacity to understand systemic behavior. So we've done lots, I didn't introduce it here, we do lots of community systems mapping, really looking at, the feedback loops and what's happening in the system over time that is leading to the outcomes that communities are receiving. Our next step is really to go deeper with these same communities and really trying to add participants that are being identified as the folks that have significant systemic leverage in that context, because everyone in the training has realized that once you're developing more awareness, you still need to be able to access people who have authority and access to levers in the context. So I think that's it for me. Thank you again very much for being able to be a part of this today.
Thanks, Joanne. And we'll turn it over now to Brenda, and Jason will be advancing the slides.
Great, thanks Jason, and thanks Neil. I really appreciate this opportunity to be able to share some of the work that we're doing around community systems, working closely with Joanne too on community systems as well. What I'd like to do is just share with you some of the work that we're doing to understand community systems that are promoting children's healthy development in the early years and beyond. So I'll share with you some of the work that we've been engaged in the last 5 or so years, aspects of some of the processes and approaches that we're using, as well as the findings. Next, please. So this work is really rooted in the population level data that we've collected over the last 17 years. As Joanne mentioned, we have a richness of population level data that we've collected with the EDI, which I know all of you would be very familiar with, so I won't describe that in any detail. But as Joanne mentioned, we see that in British Columbia, we have about a third of children, kindergarten children, who are developmentally vulnerable. And we haven't seen, unfortunately, great improvements in that over the years. But we've really used this data to drive sort of our approach here in terms of understanding community systems. Next slide, please. And again, this is based upon the data that we've collected from the early development instrument over the 5 domains of development. Again, I won't go through that in any detail. So next slide, please. So here in British Columbia, and you all will be very familiar as well, around maps that are developed from our population level data. So here is reflected the province of British Columbia, and we have from our wave 6, the rates of developmental vulnerability on 1 or more scales. And we know that the darkest red areas are those areas with the highest rates of vulnerability, and those in the lightest color, the pinkish to the light cream colors, are the areas with the lowest rates of vulnerability. Well, we also know that there's a lot of variation, as you can see, and this is at the school district level. And we also see that widens in terms of the differences that we see at the neighborhood level. So we see a range where a low of vulnerability of 9% at the neighborhood level to a high of 60%. And these data are data that we have shared over the years with communities and have been very active in terms of sharing that. And Joanne herself was very active with our founding director, Clyde Hertzman, in taking these data out to community so that they could get an understanding of what's happening in their local area. And next, please. And what happened through that is a response. I'd say not totally contributing to the EDI, but I think the EDI was a major jump starter for some communities to get together and mobilize. So responding to the vulnerability rates in their community was one means for which this collaborative action that Joanne mentioned around early years tables in British Columbia, groups coming together, organizations coming together to better understand what could be contributing to developmental vulnerability rates in their community, and also importantly, ways that they could mobilize and try and act in response. So here in British Columbia, we have a long history of collaboration. We've had early years tables since around 2000. Now, very recently, we've seen a shift in funding, so a bit of a pull from that support for collaborative, formal collaborative action. So it will be interesting to see what emerges. But what this work that I'm doing has been very focused on is the nature of the collaborative action that's happened, particularly in the context of these early years tables. I'd just like to tell you a little bit about that. So next slide. And we know that collaborative action has been something that has been highlighted, and in particular, multi-sectoral collaboration. So we've seen, even from the National Academies of Sciences, Engineering, and Medicine, they've highlighted the importance of community efforts to address health inequities. And there's 3 points, if you just click. 3 points that they've highlighted around shared vision and value, importance of increasing community capacity, and also fostering multi-sectoral collaboration. And this is something where I wanted to gain a better understanding of what was happening in British Columbia and selected communities around these areas, and in particular, what was happening in terms of multi-sectoral collaboration. Next, please. And so generally speaking, the area of interest for my research program is to better understand that complexity that's happening in communities and looking more closely at what types of community systems level factors might be contributing to the different rates of developmental vulnerability that we've observed through the EDI population level data set. Next, please. And how we've done this, so our approach, and there's just if you can click forward on this, please. Is we're using a mixed methods approach. So collecting qualitative and quantitative data within a multiple case study design, and using system science tools to really understand what could be happening within communities, particularly in relationship to community stakeholders coming together and organizing themselves towards action. So our systems science tools, we're centering around 3 at this time: social network analysis, concept mapping, and causal loop diagramming, and I'll speak a little bit about each one. And if you just click further, please. And we're using this information to understand whether there are any patterns of difference among things like multi-sectoral collaboration, for example, that could be contributing to some of those differences in vulnerability rates that we've observed. And we'd like to use this information, integrate it, and also apply it in ways that could hopefully inform planning in communities, as well as their evaluation and shared measurement practices as well. And we view this as a loop. So we see, if you click forward, there would be an arrow coming back where we see this a process of gathering that data, analyzing it, assessing it, and hopefully integrating, applying it, sharing it back with communities so that it can be used for their own planning and move forward. Next, please. So one of the areas of research focus is around those collaborative, the collaborative action. So better understanding those community networks in relationship to health inequalities, and specifically how do community network collaborative practices compare in communities with highly different rates of developmental health vulnerability. Next, please. And the areas that we're looking at in terms of community networks are centered around 3 areas. So multi-sectoral collaboration, leadership structures. So we're also interested in leadership, as Joanne is, but we're interested in the structure of it, and also in what collaboratives are doing. So what kinds of practices are these early years networks engaged in? Next, please. And we're using a sort of theoretical framework around understanding collaboration. So we understand that collaboration can happen where there's really minimal collaboration, so this level of coexistence or parallel lanes, if you will, where organizations, community stakeholders are really working quite independently in a siloed model, to ones where if you go across the continuum, there might be greater levels of coordination, networking, collaboration, and finally to more collaborative action that is maybe more transformative in the sense that it's about co-creating strategies and solutions together. And so this was a model that we used to try and understand these networks and actually map them out. So next, please. And this is one way that we've done it. So we ask partners in selected communities with different rates of vulnerability to tell us about their collaboration. So in surveys, we ask them, for example, who do they collaborate most frequently, organization by organization? And this is reflective of one community where we see represented here, each line item being a different organization, the number of interconnections or ties that they have with others in their network. So we see that the highest number of ties in this case is amongst the child care resource and referral group, and the lowest amongst the community foundation, which has only 3 ties. So this is a way for us to get a sense of really how many interconnections are happening around the early years. But it also, if you click forward, gives us a sense of that multi-sectoral aspect. So we see that the greatest number of ties in this particular case really cut across different sectors. So we see childcare, public health, education represented in various ways, city council, and And so we were able to kind of just even see the composition of these networks and the extent that they are reflecting different sectors, and also the extent that they're working together. Next, please. And drawing again from this continuing collaboration, this is also what we're using to think about collective leadership. So this is also a way for us to network or use social network analysis to look at different models of collective leadership. And if you click forward, we see that different types of collaboration could also be associated with different types of leadership structures. So you might have ones where people who are working more in a coexistence model or parallel lanes, there might be one, lead agency or one agency that's really taking everything on, to other models along the continuum where you see more of a collective or co-leadership model. And so this is also one of the areas that we're interested in trying to see whether they were seeing any patterns of similarity and difference across different communities. Next, please. And so this is just one example where we have collected data from 2 communities, and each one of those reflect different networks. So there's the early years network in one community and an early years network in the second. And each one of those circles or nodes represents a different organization. And through this, you can't see it, but we would show through the network the interconnections or ties that are occurring across those organizations. And what we noticed is that there are more ties that were clustering with certain organizations. So here we see a lot of interaction and interconnection happening amongst the group in green in community 1. And this is where we noted through our qualitative and quantitative or network data, sort of a clustered leadership model where there's a core leadership group at the center that seems to be very important in moving things forward in the community. And we contrasted this with a geographically adjacent community with similar sociodemographic characteristics and found that there was a very different model in terms of more of a distributed leadership, or what we termed a collective leadership model. So much more of a sharing across more members of that network. And if you click forward, please. This is one of the areas where we noted that there was a pattern of difference in terms of having more of a clustered leadership model in our lower vulnerability community versus one in our higher vulnerability community, which followed a sort of a different pattern of leadership. And so this is an example of one of the ways that we were trying to understand the structure of leadership within the context of all of the population level data around, where we're seeing pervasive differences in developmental vulnerability. Next, please. And so again, going back to this continuum, we were interested in not only the structures of leadership and the nature of collaboration, but we wanted to know about their collaborative practices too. And this is where we, if you click forward, are looking at what the networks are actually doing with one another. And again, along a continuum where you might just have little or no collaboration, to really where they may be just starting to share information with each other, to the other end of the spectrum where they're starting to really share resources, engage in more joint program development, and wanting to see what's happening in various communities. Next, please. And so we use this, and we use social network analysis here to understand and obtain measures of density. So we get a sense of how dense those networks are around information sharing. So out of all the possible ties that are present around information sharing, for example, which ones are actually being utilized? And so we see that information sharing is one of the areas of collaborative practice that is highly prevalent across all of the networks that we studied in our case study project. But we see less so in terms of more of those, if you will, advanced types of collaboration like resource sharing, where you see the density is quite low in relationship to, let's say, information sharing, where you see a large proportion of ties being utilized. So just to give you a sense of the range of types of collaborative practices that we studied, and also that there's a diversity in terms of what they're actually doing with one another. Next, please. Yeah, and that's fine, thank you. We can go on to the next one. And this is how we represented that within a network diagram. So we would do the same in community network, with our community networks, for example, again, 2 adjacent communities, and see that visually we see through social networks there's a difference, and you can see how there are more ties in community 1 versus community 2. But not only that, you see a different way of interconnecting with one another, where organizations are more, have more ties with one another versus more of these discrete straight line networks in community 2, where one organization may be sharing resources with another organization, but it's not multiple as what you see in community 1, where you might see an organization interacting with many other communities with multiple ties around financial resource sharing in this case. And again, next slide, please. And this is, again, 2 communities that differ in higher or lower vulnerability. And just briefly, I just wanted to share with you what we're doing right now as a follow-up is that in terms of using system science, we're also interested in understanding theoretical explanations of those health inequalities, but those that are grounded in community experiences and perspectives. And specifically, we're interested in the key factors that could be influencing community rates of developmental vulnerability from the perspectives of those in community. And also understanding how can these theoretical explanations be used to inform community-based planning and research. Next slide, please. And we've used a systems approach here, as I mentioned, and know that it has value in really understanding the complexity of the system, and also has that potential to be able to help us see potential solutions at those multiple levels of individual level or most proximal to the child, to those at the policy level. And next, please. And I think many of you have seen this before, but in terms of thinking about the multiple spheres of influence, thinking that a systems lens can really help us think about the complexity of the system and causes for action or causes for concern or vulnerability, and be able to in some way use these tools to facilitate some deeper complexities about the complexity, but also explicitly and deliberately engage community in steps of the process to think about subsequent planning that could be owned and driven by that community. So it's a very participatory approach within this part of my research. So really trying to engage people at various levels in community, from leaders to service delivery, about opportunities for action. Next, please. And we're using a couple of tools, and I'll just briefly go over those, but the ones that we're using, as I mentioned, are concept mapping and causal loop diagrams. Next, please. And what we're doing in our case studies here is we're engaging a concept mapping process that really begins with that importance of engaging community stakeholders, but engaging in a process of brainstorming and having community sort and rate what the key issues of concern are in relationship to developmental vulnerability in their area, and talk about rating them in terms of importance and priority. And we engage in some analyses through this process, through this concept mapping process, that will then lead to findings that we take back to the community to get their interpretation about the issues that they identified and the priorities that they've also identified. Next, please. And just, again, we're another part of this, it's very related in terms of coming up with a bit of a theoretical, community-grounded explanation for the vulnerability rates. We see that we've asked communities to come together in sort of facilitated focus groups to talk about what they see as the key drivers for vulnerability in the area. So here, this is an example where they've looked at social emotional vulnerability and also looked at, in particular, insecure attachment, and try to identify some variables that are important and also interrelated. And this is the initial step for our process. Next, please. I'm just going to close. Really, we ask the participants to tell stories, and this is a way for us to see some of those multi-level factors that are identified within each community. And you can just click forward. So those variables at the level of the child, the family, and society, they're beginning to be identified within each community. And ultimately, what this is going to do is contribute to a causal loop diagram. So this is an example that we don't have, we're just generating this now. So if you click forward, this is one related to obesity that's been developed. And you can see that it really does display, I think, the complexity of the system in terms of trying to understand developmental health outcome. And so this is ultimately where we're leading towards, is developing a causal loop diagram within our communities to get a sense of that complexity and the various drivers for that, and also opportunities for action, and identifying key theme areas. And finally, next slide, we view this as an iterative practice of research and action. And if you click, there's just a few points here. So my research is really focused upon kind of understanding with community the theoretical explanations that we hope can inform planning and policy and practice. And on the other end of that, but very interconnected, is to come up with this idea of theoretical testing some of the theories that we generate within community, these grounded theories, testing them to see, well, what further data we can collect that would be important in future data collection to better understand what could be contributing to developmental vulnerability. So that ends my portion. And just next, thank you again for the opportunity to share a bit about the research that we're doing.
That was great. Thank you very much, Brenda. And it's great. It's been a couple years since I've heard your presentation, and just great to see the progress you're making and the kinds of tools that you're using. And I'll just mention for our team here at UCLA, because of the All Children Thrive work we're doing in California and other places around working with cities as the sort of unit, and some of the approaches that you've laid out. We're also doing some causal loop mapping and using some of the same kinds of techniques. So I think there'll be stuff that we can be sharing in that regard. I just want to turn to the questions that came in and begin to focus on those. And the first one is up there. It's from Sarah John, and it's for Joanne, who was trained in the community organizations. So when you're working with communities, who do you interact with? Is it mostly executive leadership, or is it staff, or how does that work? And then I think it's an important question, because we're seeing some places like Cincinnati, they have something that they call, they have boot camps for the sort of staff and managers, and then they have kind of leadership training also. So I'm curious about who you involved with your training.
Thanks for the question. It was really a bit of a self-selection process. So the way we identified the communities is we had a call for proposals, and a number of communities across BC put in their proposal. And so it looked quite different in one community to the next. In one community, that was the superintendent of schools that was involved. In another, it was an assistant superintendent. So we didn't emphasize in this round that people needed to be in a certain position, although I think it clearly has been one of our learnings that in those communities where there were more senior management participants, that there was an ability to have more impact. So as much as we want to think about leadership as existing at every level of the system and wanting to nurture it at every level of the system, there's also that recognition that there is more leverage if you have more senior folks involved.
Yeah, just to comment on that from the Cincinnati perspective, they're running two levels of engagement around leadership. One is their Impact U, which is all senior leadership in organizations. And what they do first is they engage them in complex systems thinking and thinking about how you make change in complex systems. And they help them learn some QI techniques about making change. And they work on their change in their own organizations first. So it's not in any common framework, but just in their own backyards, what they're concerned about. And then they use that as a way of not just training them and getting them sort of sensitized to that, but as a way of then bringing them together now that you've all learned how to make systems change in your own organization, or the ways that you could be joining forces to make, system change across the community in a different kind of way. So, and so they do that in a staged kind of maturation development process that they have, and it seems to be working fairly well. They do another set of what they call boot camps for managers and people that are not leading the efforts, but are doing the day-to-day work and managing the things. And it's sort of the right training at the right level, so that people, are being asked, just like you need the right data at the right level, you need the right training at the right level.
I have a related question for you, Joanne. And I really do appreciate how you started with an acknowledgement of the debt owed to your indigenous populations. And I'm wondering, since there's a lot of activity happening in that regard, particularly in Vancouver around, respect for those indigenous populations, is there a level of do you think it creates more of a readiness for the leadership to get more involved with some kind of a compassionate orientation to your work? Because I'm just trying to figure out how we would kind of incorporate that into the work here in the United States, since we have such a different orientation of our, we have this sense of independence here, and you pull yourself up by your bootstraps. And I'm wondering if there's
bully your way through life now.
Right. So we're just wondering if you can share your thoughts on that, and whether or not if people were just ready for it already, or do you think that the local policies had some impact?
Well, that's such an interesting question, Efren. I think broadly, yes, the emergence of our country's, willingness to really address some of the questions around reconciliation with our First Nations is a contributing factor. But maybe I'm naive, but I also think that there's a global move towards compassion, and the role of compassion as being an important foundation. So, I've had lots of chance, and actually was just down for training for a week in Boston a week or so ago with lots of people from the US, and talking about it in your context. As I say, maybe I'm naive, but I think that the resonance is there. There's so much happening in the globe around climate change and all of those kinds of things that people know that there has to be a different way to do it. So I don't think it would be exclusively based on the First Nations principles around that, although they certainly are an important component in our context.
Let's move on to the question for Brenda, and my comment about what Cincinnati was doing in terms of how they're training leadership sort of melds into some of the discussion that you were raising around different forms of leadership. And the question that came in was, the difference between clustered and collective leadership, since we could see the diagrams, but we're not quite sure what the diagrams mean. So if you could maybe comment more on that and explain that a bit more.
Sure, no problem. So we looked at what emerged again within these two adjacent communities, and through the social network analysis itself, we were seeing a greater number of ties amongst clusters within the first community. So in ways we were able to identify where there were a stronger interconnected network cluster that had emerged that was really at the center. And there were also members that were involved, but that were more on the periphery. So we saw this sort of a core group, and we also saw the periphery players that also played a role. Whereas in a collective leadership, we weren't really seeing that multi-level clustering in the same way. We saw really that the leadership decision making, for example, processes for working with one another. And this emerged through the combination of looking at the social network data as well as the qualitative data from each network, was highlighting that there was really more of a distributed model of leadership within the second community that was less. What was less evident was having a core group. So whereas the community one had a core subset that I'd say, if you want to equate that with some of the power of decision making, was more evident in the first community. With having this consistent group over the years, like more than a decade of membership, multi-sectoral, that's that group in the green that I mentioned in Community 1, multi-sectoral representation, long-standing representation, and leadership, senior level decision makers. In the second community, we also saw stability in terms of long-term membership, but there wasn't that same subset in terms of maybe having a little bit more of a bit of a hierarchical structure in terms of having a little bit more power amongst certain decision makers within that group to help move things forward. So I think that what emerged was this difference in terms of the clustered networks that we could certainly see through the data, as well as qualitatively we would hear from members just a different way of coming to their decision making making their decisions around all sorts of areas, whether it was what objectives they've achieved to how funding would be allocated. Is that helpful?
Yeah, it's very helpful. And again, I'm going to relate it to the work we're doing around all children thrive in cities. We've conceived a city as an ecosystem, and there's the city level government and departments and things that happen at a city level. And then typically you drop down to the community level and you have community coalitions and you have community groups working on one thing or another. And you're both familiar with the Magnolia Community Initiative, which is a community-wide initiative working on things. Asthma coalitions or, around particular problems. Then you drop down to another level, which are actually the community-based organizations, health systems, programs, and then down to even another level, services. So we've had this sort of multi-level model of looking at city systems. What we realized is there's a level we haven't been kind of paying attention to, which is between city government and the community coalitions. And we're calling this kind of a level of complex adaptive community leadership coalitions, where you have some city and other governmental and groups along with the community coalitions, and they come together in an adaptive way with leadership that realizes they're dealing with complex kind of wicked problems that are going to take long-term commitment. And so that the leadership pattern being set up is both for problem solving but it's also in leadership cultivation and leadership coordination, funding coordination, and sustainability so that they can be in business for a long time, recognizing that the leadership is likely to change and there'll be some handing off of batons along the way. But we're trying to sort of understand is that it seems like that's your clustered leadership level, potentially using your typology and some of your tools will help us understand this, because there's starting to be writing about this complex adaptive community coalitions and what roles they play. And I'm wondering if, Joanne's approach is kind of the on-ramp or invitation into this both different way of thinking and understanding you're connected to everyone else. And this is how you take advantage of those connections in different ways. So we're trying to figure out, is there ways to facilitate this kind of leadership at that level that kind of connects the sectors and connects the levels together? I don't know if that makes sense.
Well, I can speak to, and it's interesting when you mentioned the connection with cities, Neil, because I feel like that was an area that distinguished some of our networks as well. So we saw active, like even in the community example that I showed you, where we had the city involved in multiple ways actively within that network, but not actually to the same extent at all in the second. So understanding how they were able to get that sustained involvement of their municipal leaders was important. It was a priority within that particular network, and it became a priority at the city level. So much so that they were able to put multiple representatives on that particular committee. And they did talk to, and I'm thinking again about this particular community case, where in terms of sustainability, this idea of having the senior leadership represented across different sectors was highlighted, so that it wasn't linked to the particular person, but it was important that the leadership carried on no matter which person was in that role. So it was expected that you would always have a municipal leader on that committee. Whereas in other coalitions, we saw that it was really tied so much to a person. So once that person moved on, then there wasn't a replacement that was expected. Whereas that expected level of participation and engagement was in some communities. There's a difference there.
Makes a lot of sense.
So Brenda, your work is quite amazing, very fascinating to us on multiple levels, as Neil's pointing out. But I was wondering if you can talk about very briefly your continuum of collaboration, how you went from coexistence to transformation, and then how you had all those other factors like little or no collaboration all the way to resource sharing. Mm-hmm. And in relationship with these different leadership structures, is it that the first, the clustered leadership lends itself more to resource sharing the way that it is organized? Is there a relationship between the two, and maybe the way you guys are thinking about this kind of continuum, like maybe it's lending itself more towards that later end, where you're actually sharing resources, something that you might not be able to do with the distributive leadership model, since they may not have control over the purse strings, if you will?
Mm-hmm. Yeah, that's an interesting question, Efren, because we started with looking at the theoretical frameworks that were available around collaboration, and noted this idea of the continuum and having the parallel pathways to those that were more transformative. What happened was that through the work that we were doing with some of the government work actually around early years, was that there was this idea of the importance of integrated practice as well. And so that led us into thinking about collaborative practices, particularly those that were around greater coordination and integrated service delivery. So we were understanding these, and we were in a way, we're layering different types of frameworks with one another. So we're trying to understand in some ways around what's happening in collaboration, as well as what's happening in terms of the continuum and level of work around integrated service delivery and coordinated action, to the idea of understanding different collective leadership models. But we're in the place where we're layering each of those data with each other to try and understand whether there are interconnections across, because we are seeing some emergence of, particularly at the coexistence level, where we see that coexistence and collaboration really means that there's a level of integration that's non-existent, really. So there's that level. And then we also see at the other end where we see more transformative collaborative action, where there really is more the co-creation of strategies. There's really a merged authority level. I think that's a key part of it in terms of merging authority, merging capability that becomes really integrated within the model that is associated with what we're noticing around things like resource sharing, especially financial resource sharing, where they would have come up with a funding model that really reflects that or merged authority. And that's something that is distinct from other types of organizing themselves that we would characterize within more of like a coordinated type of approach. where there still is maybe a lead group or lead agency that is, let's say in the case of funding allocation, is still really taking a lead role within that. But we see other networks that are moving towards something more of a merged kind of structure.
I think one of the really important things from Brenda's work and what she's speaking to is the ability to kind of unpack the specific behaviors of collaborative and integrative practice, because it's really been my experience that when you talk to people about this, their self-report is going to be really erring on the positive side, and that what the data will tell us is everybody thinks they're highly collaborative, but the ability, as Brenda's speaking to actually look at what are the behaviors that people are doing is a really important piece of that work, I think.
Yeah, I think, yeah, exactly as Joanne mentioned. And we've gone through different models of our data collection where it's exactly as Joanne mentioned, in that we're hearing so much in terms of positivity about what they're doing together. But it wasn't until we started to dig into the activities themselves, more specifically around things like resource sharing, and case coordination, for example, we're really able to see the differences where they might self-describe themselves as very collaborative, but in terms of what we're seeing in the continuum and maybe more complex types of ways of working together, they weren't really necessarily in sync.
Yeah, it's also incredible. I think that what's really, really interesting is when we're looking at these things like the collective or collaborative leadership or distributed leadership models, we're really trying to figure out, like, well, what are the results? Like, is it the community itself is functioning in a different way? The community system itself is functioning in a certain way that would yield the improved or the optimal outcomes on the EDI? Is it a reflection of what's happening within the constituent community, or is it a reflection of the leadership strategy or leadership model? Because you said they were both similar socioeconomic strata, right? The community 1 and community 2. So that's what I'm trying to get at, because I know that part of me is, of course, it's my hope is that we can have more of these distributive leadership models, but if the data are indicating that maybe a coordinated leadership model actually works better, then maybe we really need to get at it's how they function together as opposed to the specific leadership model.
Yeah, there's also an element, Efren, that I think we have to take into account, that there's a development maturation that happens in communities as they move forward,
right.
And the leadership model has to fit the sort of level of maturation. So just like in kids, you need different, more authoritative parenting versus more independent. There's a way in which certain times you need certain kinds of leadership to get things off the ground,
right.
And then they can hand it off to the next group that's going to take it to the next level and then the next group. And as long as we can begin to lay out the kind of maturation process, and there's certainty about the values and the vision, as Joanne was talking about, and in fact, because we live in such uncertain times, having certainty about values and vision is really important for people, I think. If we can be certain about that and build leadership around values like compassion and equity and other similar virtues, then leaders can take that role, understanding that the flag that they're carrying is the shared vision and value flag forward, and they're coming in a adaptive way because it's their time to sort of carry the ball forward and hand it off to the next. And I think, what's so appealing to me about what Joanne and Pippa are doing, as well as what Brenda is doing, is they're helping us start to think about this differently, build those tools, and figure out what that maturation approach is, and how do we, nurture leadership around, you know, certain values and vision that's shared, so that it creates a true north for people to sort of know which direction to head. So, we're getting close to the end of our time. There was one other question from Jennifer Lopez about how compassionate systems approaches rooted in First Nation community practices. And I think what we'll do is let Jennifer, maybe Joanne, I'll give you Jennifer's email and you can send that to her. I'm also interested in that because last week I spent last Wednesday in Oklahoma City at an Indian Health Service major, big national conference, several thousand people there on obesity and diabetes, and I learned a lot about what would be our First Nations, our Native American approaches to cultural rejuvenation and bringing forth a whole set of practices that are having rather significant impact on how they're able to now respond to diabetes and obesity in really positive ways. They're making really good progress on things. So I think that understanding more about that will be helpful for all of us. But with this, I'm going to sort of bring this to a close today and thank everyone for participating. It was really a fantastic webinar and information, and I think the discussion and relating it to our individual practices in our respective countries and differences was very rich and useful. We will be having one last webinar in this series, and that will be one that Pippa Rowcliffe from HELP will be presiding over, and I'll be helping her with that. And that will be done sometime in October. So stay tuned for information on that, and we'll allow that. We'll get that out to you. So we hope you'll join us for that. And there's two more.
Data linkages. There's another one on data.
We already did that last week.
Oh.
Yeah. So, and remember that all these webinars are on our website, and please tell your friends, you know, a nice box set makes a nice Christmas present. You know, think about ways you can use them. So thanks.
Thanks,
It
you
was
guys.
amazing. We're big fans here.
All right, thank you.
Thanks very much.
Bye, everyone.
Bye-bye. Thank you.
Thanks again.